Welcome in. I'm Tiffany Bittner. I'm joined by Dr. Eddie Bugg, a urologist here at St. Vincent's, Birmingham. And Dr. Bugg, we wanted to talk to you about using the Vinci Robot for your urology patients. So how do you use it when it comes to surgery?
Well, basically, the robotic system is an extension of laparoscopic surgery. And so for us, it's ideal for anything that's down in the pelvis or anything that's going to require a fair amount of suturing. The robotic system, all it is a glorified computer. Essentially, it's made up of two parts. We have a console over on the side of the room where the doctor sits, and then you have the actual robotic component, which is docked up beside the patient, that has robotic arms, which essentially hold the instruments that allow us to do the same type of surgery that we would do open. The way that the robotic system works is whatever the physician sees through the goggles or the part of the console where they look through, it gives them a binocular vision with the camera, and so in turn that gives us a three-dimensional magnified view. And then our hands fit in a console, so whatever the left hand does, that's what the left arm of the robot does, and whatever the right arm does, same thing with that. So you're doing the same surgery, just with a different approach. For urology, it's ideal for prostate surgery, whether it's prostate cancer or whether it's for BPH type surgery. It's ideal where you're working down in a tight area, down in the pelvis, where you need the magnification and you need to be able to move in small areas. It also works very well for surgery such as various kidney surgery, where you're going to need to be doing a lot of suturing and with the three-dimensional vision. Initially, when we first started doing this, the clear benefits up front were things like less bleeding, less pain, faster return to normal activity, shorter hospital stay. As we had more experience with this, we started seeing more benefits. For example, with prostate cancer, certainly things like faster return for normal urinary control or normal erectile function. We started seeing improvements with all of that with the experience. The big thing for us, when we used to do open prostate surgery, you were working down in a dark hole, and oftentimes you would have a fair amount of bleeding. And so being able to see what you were doing was very difficult. With the robotic system, we're able to visualize everything up close under 3 dimensions. Everything's magnified tenfold, and you don't have the bleeding like we used to see with the open surgery. So all around, we feel like we can do a much better surgery. Fortunately, St. Vincent's was one of the original hospitals in the country to incorporate the robotic system. So for us, it's been great. We've had patients from all over the United States, even from other countries, that have come in to this hospital really because of the robotic system.
Thank you, Dr. Bugg. We appreciate you sharing some of your thoughts with us. If you'd like to learn more about robotic surgery and Dr. Bugg, you can contact him here at St. Vincent's, Birmingham.